Today I had ketamine infusion number 9. Only have one more left to go on the loading doses, which I am very happy about. Today's infusion, the doctors made the decision to go up to 200 milligrams with me. And I was a little bit leery about it, but I'm trusting their judgment. It was a little bit rougher, but I did well. Blood pressure got elevated a number of times, but the staff took care of that. Oftentimes, that can be rectified with positional changes or getting me to deep breathe, which if I will follow cues. If they tell me to deep breathe, I do deep breathe. I apparently was experiencing some hallucinations in which I was at a gathering with my grandmom, apparently. And apparently at some point we ended up on a train, and I'm not quite sure about that. Although I do remember as a kid getting to go to Edaville a number of times, so maybe there was a part of my childhood coming back there. Apparently we were singing at this party, and apparently I was singing in the infusion chair. It's definitely interesting in the fact that you are who you are, as raw as can be. If you have ever been sedated for surgery, you will understand what this infusion is like, and you're in that haze for about 2.5 hours. So your mind is going to play tricks on you while it's dealing with the disassociation that is caused by the ketamine. I will say there's a number of areas in my body that feel numb, where the nerves have just been bathed in the medication, causing them to be numb. I've had some spasmodic activity that is not expected to be controlled by the ketamine, unfortunately. But some of that is, well, most of that is derived from my tram flap. And of course, the CRPS increases the pain there, but it's not something that we're going to be able to fix, or, if you will, with ketamine. What the treatment is doing, though, is it is making it a little bit easier to get through those spasms, and sometimes the pain might be intense, but it will go away faster. I am still unable to have a lot of mobility. They let me know today that after tomorrow's infusion, my instructions are to rest for 2 weeks, and then I will go back for another infusion, which will be the first of what are called boosters. After that, it will be every 4 weeks, unless or until my body will allow me to go out further, which is the hope. I will, of course, continue to be posting blogs. I do intend, after loading doses are over, to kind of go over the entire experience, the good and the bad of it. The good being that, yes, there has been a decrease in pain and burning in some of the pins and needles and the iron bra and the iron corset. However, the muscle tightness that occurs from my tram flap and the breathing issues that can sometimes cause, or disruption to my stomach, that's still there. So I have to be mindful. It's very easy to think that it's okay to do something, like go and lift something up. Like I went to pick up a bag and it was heavier than I expected, and immediately it was an ow and put the bag down. But you really need to be kind of cognitive that just because the level of pain that you're feeling is improved doesn't mean that you can do something that you ordinarily wouldn't be able to do. It's not permission to go back to pre-disease levels. You see Christian hiding behind my head. who has discovered that massage therapy, or not massage, but just rubbing or what have you, it can sometimes be beneficial, especially after the infusions up in the shoulder area. As with surgery, these medications are used for sedation. So, you think of a surgery, they always tell you get gas bubbles up in your shoulder areas. That occurs with this infusion therapy as well, and it can be kind of painful. So, by having somebody work some of that loose and help to get that loose in your body, also, just to mention, yeah, you should take stool softeners. Keep everything moving. Lots of fluids, waters. I mean, drink plenty of water. Really, really important to drink plenty of water. Keep yourself hydrated. And that helps because remember, when it gets to be, depending on what time your infusion is, for me, my infusion has been 8 a.m. So come midnight, I am no longer eating and drinking, really. I can take small sips of clear liquids, but really you don't eat or drink anything prior to the infusion because it increases your risk factors of having vomiting. And they don't want you to have those kind of side effects. I did have an instance during my infusion today where I experienced what they thought I was going to vomit. But we were able to combat that with Zofran and deep breathing. So we were able to take care of that. I also wear a C-band, which is an acupressure brand that you can get at any pharmacy right on my wrist to also help with nausea. That is a big thing to be able to keep down. I've been eating light and keeping my meals small. Usually I wake up around 4:30ish in the afternoon, and that is when I start to kind of come around and I'll have a light something to eat. But I will tell you this, one thing that we have figured out, at least for me, and I'm not sure if it'll be the same for everyone, but because the medication makes you so dry, and you can experience hot flashes kind of, or getting too hot while you're getting the infusions. I have found that when I'm laying down in the car, I lay on my side, and they stop and get me a cup of grapes, and munching on those nice cold, juicy grapes on the way home actually helps me feel better. And then I usually doze off, and they wake me up when we arrive home, and somehow manage to get me into my room, and I'll crash into the bed, and I'm usually out for a good 3 hours or so, or longer sometimes, after the infusions. It really does take a lot out of you. If you can't tell by watching this video blog, which I think we're up to number 12 now?
Yep.
I believe we're up to 12. Yep. And if you can't tell, I am really, really fatigued, and that is normal with this therapy. You don't want to be making plans to go anywhere or do anything. And I don't recommend having visitors. You get headaches, sometimes they can be pretty severe, and the fatigue that you're feeling, the quieter your environment is, the better. The less stimulation you have, the better. Keeping it calm, and if you start to feel a little bit off, put on a comedy, put on something that makes you laugh, because laughter, of course, is the best medicine for when you're not feeling good. That is about all I can tell you about today. I will be spending my last night with these lovely appendage. my little Borg thing here. We are Borg. See, it's not that bad. It's weird. I will say that. It is weird to have this like this, but it wasn't as weird as I thought it was going to be. And no, it doesn't really hurt. If I lay the wrong way, yeah, I can cause myself a little bit of pain, but for the most part, It doesn't really hurt. And if your nurse is good, which mine are, you don't really feel it getting access too badly. I've had a few instances where it's hurt pretty bad, but usually those have been in emergent situations or it's been some kind of an issue with the access. I've been very blessed that both weeks they've been able to access just first shot, no problem. And if that's something that is on the table for you, you weigh the pros and cons. For me, having a port is a necessity, not only for infusions, but because I have no vein access left in my arm. I've actually had the port now for going on to 4 years, I believe. And you get kind of used to it, and it has to be maintained, it has to be taken care of every month. And I have to go in and see nursing staff for that. I do not have the capability of sticking a needle through my chest. I don't think a lot of people would. But it does make getting these kind of things done less harmful on your body, less risk of infection, less risk of ending up with something like a phlebitis or a deep thrombone phlebitis from IV intravenous access. And of course, repeated needle sticks carry their own risks. With any CRPS patient, every needle stick is a risk for spread. So having a port in these instances and for those reasons can be a very good thing for some people. And for folks like me who have limited or poor IV access, it's a best thing. It's a best practice choice. So some things you just got to kind of accept, and I make jokes out of it. I play with it like it's a boa. Why not? It's mine. I've sworn that if it ever comes out, I will own it. My understanding is it is purple. I want proof. I want to see it. It's my favorite color. So I have a little purple mini heart above my heart. Ha 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 ha. No, only kidding. So I will be back tomorrow with my 10th and final loading dose video blogs for ketamine infusions to treat complex regional pain syndrome type 2, CRPS, also known as RSD, reflex sympathetic dystrophy, and also treating post-mastectomy pain syndrome. I will say that as a side note, it has helped my endometriosis pain, and it has benefited me in dealing with the damage from my transplant surgery. Not 100%, but in part, and any improvement is a good improvement. And any breakaway from any kind of pain is definitely a move in the right direction. So I'll see you guys tomorrow.